So in the previous class, completed the types or classification of bone. In this class, we'll cancellous bone and part that compact or cortical and their related screws like screws or cortical screws. Okay. A long bone is having these two these are and this is the shaft, which is called as these ends. They have something called as spongy bone or cancellous, but this part is having compact bone. Compact bone may be of type. One is called as woven lamellar. Woven means immature. Lamellar means something which is mature. So cancellous bone is present in epiphysis, but this compact bone it is present in the diaphysis. It is present in diaphysis. So first we'll see if we take one cross section or section of the compact bone, this part, then the structure will come out like this. This is external part. In the center we have bone marrow or simply marrow cavity. This external periosteum, this is known as periosteum, and this part just outside the marrow cavity, it is known as the end. So the outer covering of the bone is the periosteum, and the covering which is inside but outside the marrow cavity is the end. This periosteum is having two layers, outer layer, inner layer. Outer layer is called as outer is the fibrous layer and inner is the cambium layer, or one more name is osteogenic layer. So why to study these layers of the periosteum? There too, this is the fibrous layer. Fibrous means having type 1. They have asked, this fibrous layer is the and this is your dense irregular connective tissue. This was the MCQ in ICAR exam. Outer part of the periosteum is the fibrous and the nature of this fibrous layer is irregular connective. So as we know, having ONE. One means it has collagen as a predominant fiber. Is the fibrous layer, and now if we go inside the second layer, this is known as osteogenic layer. This is known as osteo layer. It is having osteoblast cells or precursor cells. What is the role of this layer? Normal bone growth. Second, fracture in. And third is the remodeling. So these are the three areas, three roles layer. In case of fracture healing, we see, suppose this is the bone, this is the periosteum. There is a fracture. There is a fracture. At this area, this osteo will be stimulated and it will start proliferation. So, osteogenic layer will start proliferation, lead to formation of the callus. So, in fracture healing, formation is one of the role of the osteogenic layer of periosteum. So that's why this periosteum is very important. It is having two layers, fibrous, your dense, irregular connective tissue. Second is your osteogenic, and that is the main role in fracture healing. What is the role? Now something called callus. But this periosteum is not present everywhere. Suppose this is joint. This periosteum present up to point, it will go like this.
हेलो
Highly
हेलो 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 सर, वीडियो पॉज हो गया है। हेलो सर, वीडियो पॉज हो गया है।
hello.